What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for November 15, 2020. World Pneumonia Day. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today is World Pneumonia Day, and Stephanie Desmond speaks to two experts in child pneumonia, a problem that is getting worse because of the COVID-19 pandemic. Stephanie discusses these challenges with Anita Shett of the International Vaccine Access Center at Johns Hopkins and Leith Greensdale, coordinator of the Every Breath Counts Coalition. Let's listen.
Leith Greensdale and Anita Shett, thank you both so much for joining me.
It's a pleasure to be here. Thank you, Stephanie.
Great to be here.
Leith, today is World Pneumonia Day, and I know today we're going to talk about child pneumonia. Could you please give us sort of a lay of the land of the issue?
Sure, Stephanie. So pneumonia is actually the leading killer of children under 5, and it's been that way for a very, very long time. So the latest data that we have is from 2019, so prior to COVID. About 700,000 children died from pneumonia every year. So it's killing more children than any other single cause. Now, most of those deaths are in low and middle income countries amongst the poorest children.
So, Anita.
And I just wanted to add that there is a well-substantiated but little publicized fact that pneumonia is the most common reason for hospitalization of children in the United States. And this is really important to note because it's not just a problem in low middle income countries, but also right here in this country.
Thanks for that perspective, Anita. I'm curious, we talked about COVID briefly, and obviously COVID is on a lot of our minds right now, as it's often presents as a respiratory illness. Before COVID, we were sort of on track to reduce child pneumonia deaths dramatically. What does the pandemic mean for childhood pneumonia now?
So that's a really good question. And to just answer that in perspective, if we step back a bit, I just want to think about the main risk factors for pneumonia, and they are being malnourished or living in a place of air pollution and also not receiving a vaccine. And I think the third point about the vaccine is really critical because what's happened during the pandemic is that the pandemic has worsened many things in many different ways, but particularly receipt of vaccines. So number one, there's been major disruptions in essential services that's being offered within the health sector. And the WHO, the World Health Organization, and the UNICEF conducted surveys at serial intervals. And these show very clearly that the number of vaccines that are given out this year were much, much lower than the vaccines given out in previous years around the same time. So clearly, a great many children are missing out on their routine vaccines. And many countries are trying to restore services and provide catch-up, but this will take a while, definitely. The second thing is that while there is a lot of fear among the public of catching COVID in clinics, and many have stayed away because of that, one of the biggest blows to the public was that the falling economy has resulted in a major loss of income. So priorities shifted. And so now getting food for my child is much more of a priority than getting my child vaccinated, for instance. So fewer children actually bringing their children in to be vaccinated. Also, from a broader perspective, countries were planning rollouts of vaccines. And of late, actually, this activity has been paused in many countries because of COVID-19, and priorities of policymakers have also changed. I guess the final point I want to make is also about health equity. To describe how well we are using vaccines, we often use the term coverage to indicate how much of the vaccine has been reaching the public. So we say a 90% coverage is good, but this can mask small, scattered areas of very low coverage. And this is where the poorest and the most vulnerable children with all these other risk factors are the ones who live there, and they are unvaccinated. And they tend to be in clusters, which is totally not conducive for, safety. So this is very conducive to an outbreak. For instance, the pandemic has actually worsened these gaps, worsened inequities, again, not only in low middle income countries, but also right here in the US. So this is a big battle we need to face in the coming months.
Leith, I wanted to ask you about oxygen. I understand that oxygen is a real problem. Access to oxygen, which is a treatment for pneumonia, is limited in some low and middle income countries. Could you talk to us a little bit about that?
So oxygen is limited in most low and middle income countries, and we've known this for a long time. Prior to COVID, it was one of the reasons actually child pneumonia deaths have stayed so high for so long, is that children who need oxygen don't receive it. So along comes COVID-19 and totally exposes this massive gap in the health system. So now we have more attention than ever before on oxygen, and that's a good thing. And if countries respond in the right way to the COVID-19 crisis, they can actually make sure that their health systems are not only equipped to prevent deaths amongst COVID-19 patients, but all those children turning up in the hospitals every year who require oxygen have a better chance of getting it actually now than at any time before. So this is a huge opportunity to address two problems, COVID-19 and this underlying childhood pneumonia need for oxygen.
Why is it so challenging to get oxygen to these folks?
So oxygen has not been a priority for either government health ministries or, I have to say, for the global health community. And some self-criticism is in order here. For all the good work that global health actors have done, fighting AIDS, TB and malaria with the Global Fund and UNITAID, and rolling out vaccines, Gabby's done a strong there, have not been focused on oxygen. And this was a major flaw in the global health architecture. So when COVID hit, you could not find any kind of programs in most of these countries that were supporting the health sector to close the oxygen gaps. In many cases, the countries didn't even know what the oxygen gap was. They simply weren't measuring access to oxygen or pulse oximetry. Let's not forget pulse oximetry. That's the little probe that people are using actually in COVID-19. Usually sits on your finger to measure your blood oxygen saturation. If it's too low, you need to get to hospital very quickly. And we've heard those stories through COVID-19. So that little tool, it's not expensive, is not available in most low and middle income countries. So this is an area that's been ignored by the global health community and governments, and I'm afraid now they're paying the price.
Anita, tell me a little bit about how you think COVID-19 and the things that Leith just talked about, how will that affect the effort going forward?
Leith brought out some excellent points. For instance, if you take pulse oximetry, this used to be this highly sophisticated, expensive instrument that would sit in intensive care units. But now it can actually sit in the pockets of community health workers trekking across fields to make household visits. And it's inexpensive. You can get it in many places for less than $5 or $10. So this is something that has been brought to light thanks to COVID, and it's become a lot more widespread. I see it happening in hospitals where I work in India and in Sri Lanka and Bangladesh, and we find that this is catching on. We have also evidence that's emerging that pulse oximetry can work very well in primary care centers, just out there within primary health services. And it's very easy to diagnose children and adults with respiratory illnesses other than COVID, so pneumonia, for instance. So this is one thing I think will be very useful to continue the momentum of after COVID. And another thing would be diagnostics, perhaps. When we think of pneumonia, we often don't know whether it's caused by bacteria or viruses. The importance of knowing that is that if we know that it's bacterial, then we can use antibiotics, which can be life-saving in many countries. And the advent of COVID has brought to light how important it is to make diagnoses. So I think, with all the innovation and the funds that are poured in, we should get some output which will benefit pneumonia, even in the post-pandemic period.
And Leith, what would you say is the most critical need going forward?
The most critical need is that the global health community and partner ministries of health in low and middle income countries actually prioritise the infections or other causes of death that are contributing the most to child death. At the moment, we have a mismatch between the areas that we focus on and the areas that cause the most deaths among children. So there are some glaring gaps in child survival. Pneumonia is one of them, but it's not the only one. We have gaps as well in diarrhea treatment and in nutrition right across the board. So there's these critical gaps in child survival services, and that will stop countries from achieving the Sustainable Development Goal for child survival. Now that we have less than 10 years left to achieve those goals by 2030, and unless we fill some of these gaps, countries simply won't get their child deaths down to the levels that they need to. And pneumonia could well end up being the major barrier between a country having success with the child survival goal and not. So I would like to see countries invest the most in the causes of death that kill the most children. That sounds like a simple statement, and many in the audience would think that's the way we do things, but it's not the way we do things. So we need to match investment with disease burden, and then you would finally see pneumonia getting the attention that it warrants.
Well, thank you both for joining me. I really appreciate your insights.
Thank you, Stephanie.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.